Hello everyone, welcome back to our NABH training series. Today we will discuss IPC.2, which is one of the most practical and resource-based standards in infection control. Let me tell you a very important reality. Infection control policies alone are not enough. Without proper resources, IPC will fail. So NABH clearly expects adequate manpower, proper equipment, continuous availability of supplies. In this session, I will explain each objective element in detail. What assesses check practically, real hospital implementation, common non-conformities and exact closure. Let's begin. Standard overview. IPC.2 states, the organization provides adequate and appropriate resources for infection prevention and control. Simplified understanding. There should be a dedicated budget for infection prevention and control. IPC, personal protective equipment, PPE, should be adequately available. Proper hand hygiene facilities should be in place. Isolation facilities should be available. This standard is about infrastructure plus supplies plus budget plus availability. Allocation of resources or budget. Let's start with the most important, core element. Management must allocate adequate resources and budget for IPC. What does this include? Manpower, IPC officer, IPC nurse, link nurses. Materials, PPE, disinfectants, hand hygiene supplies, sterilization equipment. Budget allocation, separate IPC budget in annual plan. Implementation, prepare annual IPC budget based on previous infection trends, consumption data, expansion plans. Ensure continuous supply, no stockouts. Assessor questions. Show IPC budget allocation. Show consumption vs requirement. No budget allocation. Major NC, PPE, soaps or disinfectants. Next, very practical and visible area. Adequate PPE, soaps and disinfectants must be available and used correctly. Types of PPE, gloves, masks, gowns, goggles, shoe covers, caps. Key requirements, available at point of use, adequate stock maintained, correct usage by staff. Proper donning, doffing, removal, immediately after use. Implementation, PPE stations in all critical areas, inventory tracking system, training on PPE usage. Real example, gloves available but staff not using, NC, availability and usage both required. Next, another core element, hand hygiene facilities. Hand hygiene facilities must be adequate and accessible. What NABH expects, at least one wash basin per patient care area. Must include running water, soap, hand drying facility. Preferable, hands-free taps. Alcohol-based hand rub available everywhere. Implementation, install wash basins in wards, ICU, OT, place, hand rub dispensers near beds. Provide pocket hand rub for staff. They will physically inspect missing hand rub at bedside. NC, this is one of the most commonly checked points. Isolation or barrier nursing facilities, final element, very critical. Isolation and barrier nursing facilities must be available. Types of isolation, contact, droplet, airborne. Requirements, isolation rooms, negative pressure rooms, for airborne cases ideally, PPE availability, door, must remain closed. Signage, isolation signage outside room. Pushpin barrier nursing includes, pay use. Dedicated equipment, restricted movement. Implementation, define, which conditions need isolation. Examples, MRSA, VRA, TB, COVID. Patient isolated but no signage. NC, isolation must be visible and controlled. Common NABH, non-CONFORMITIES, NC1, no dedicated IPC budget. Closure, allocate IPC budget, show financial records. NC2, PPE not available at point of care. Closure, install PPE stations, maintain stock. NC3, PPE available but not used. Closure, staff training, monitoring audits. NC4, inadequate hand hygiene facilities. Closure, install wash basins, ensure hand rub availability. NC5, no isolation rooms or poor implementation. Closure, define isolation areas, proper signage, PPE supply. NC6, stock out of disinfectants. Closure, inventory management system. NC7, no monitoring of resource usage. Closure, monthly consumption review. Final summary. To summarize, IPC.2 is about resources and infrastructure. Without resources, IPC program cannot function. Focus areas, budget, PPE, hand hygiene, isolation. If implemented properly, infection rates reduce, staff safety improves, NABH compliance becomes strong. In the next video of this NABH training series, we will discuss IPC.2, the organization implements infection prevention and control processes in clinical areas. If you found this session useful, like the video, share with your colleagues, subscribe for more NABH training sessions. This is MediQuality Partners, your trusted NABH guide. Thank you for watching.